Hello, good evening. And yes, I'm good, much better. Now, today's topic is as I was talking yesterday, that yesterday's session was like a warm up, right? Today is the race. Not only today, today and tomorrow, right? 2 days. So it's like today we'll be starting with the entire developmental part, right? The development part of the peritoneum. And it would be like a continuous process. During this entire journey, you will be watching that how that entire tube develops, what exactly happens to that peritoneum. From that point onwards, we'll be watching the real dissection also today. And tomorrow, in the final phase, you'll be watching all the CT scan images of the entire abdomen, where we'll be actually identifying one by one the structure, so that next time when you'll see any of the CT scan, instantly you'll be able to say, okay, this is aorta, this is liver, these are the structures, and you'll be able to identify it very properly, right? And we'll be watching it in two planes. So that's like a huge work, right? But we'll try to take it effectively in 2 days, today and tomorrow, considering that the entire foundation is absolutely fine. So you are through with, say, yesterday's concept, right? So let's start. Okay, so here is the development, right? And as we said, that GIT, right? It starts with like a straight tube, right? It starts with a straight tube. Obviously, now we know about the mesoderm, right? And this would be the long axis. This would be the long axis, right? So here it is. This is our foregut, right? The foregut. So the development has started. Now see what happens. Now as we proceed, right? It bends, right? So things which are very obvious, I'll go a bit fast, right? Then on one of the side, right, there is differential growth. So over here, there is a difference in the growth on the left side and right side. Later on, this will become the lesser curvature, as you must have guessed, right? And this would be the greater one, correct? Let's continue. And here it is. Now it really looks like that it is our stomach, right? Because that this portion has started expanding. This portion expands. So what exactly are we trying to understand? That we started with foregut, right? And this foregut would be developing the stomach, right? It would be developing the stomach. Right now we are just telling stomach. It leads to development of something else also, but we'll come to that. So here is the stomach, right? Now as this stomach, it expands, now it looks like a real stomach, right? So over here, change the color, right? It is, if you have marked, this is the stomach, but at the same time plus this portion, right? That is first part of duodenum. First part of duodenum. So from this point onwards, we'll start telling it as D1. D1. Because duodenum has got four parts, right? So D1, which is foregut, and D2 to D4, right? They will be part of midgut. So we'll talk about it, right? But this is foregut, what we are talking. The importance of it is that when we'll be talking about the peritoneal reflections, there are specific peritoneal reflections for the foregut, midgut, and the hindgut, right? So over here, we are right now focusing on foregut. So this is fine, right? Okay, let's move further. Now comes that part which is for understanding. So you understood one thing, that in case of stomach, things are like only one of the side it expands, right? Okay, let's understand this figure. Okay, now it is in center. Fine. So let's understand this. This is midgut and hindgut. Why? Because yesterday we talked about it that in case of foregut, what you get? You have got, this was the gut and it was having dorsal as well as ventral mesogastrium, correct? So if we consider this as posterior, this side as posterior, so this would be the dorsal one and this would be the ventral one, right? But in case of midgut and the hindgut, you get only dorsal one, right? So now this is very clear that we are dealing with, in this image, midgut and hindgut, right? That's what we are dealing with. This is posterior, right? This is anterior. So this curve we are considering that this would be our spine, right? This would be the back. So that's how we are considering. So that's dorsal mesogastrium. Fair enough? Okay. Now, if you watch carefully, right, this mesogastrium is what? It is a double folded peritoneum. Now, do remember this, that all these double folded peritoneums, right, they will be carrying some specific importance. So, this is double folded peritoneum, right? This one would be the gut. Now, in peritoneum, we remembered that yes, there are two layers. One is the parietal peritoneum and second one is the visceral peritoneum, right? It's part. Sorry. So this one would be the parietal, which is fibrous, which is for protection, right? And this one would be the visceral. And visceral will be having secretions, right? So this is where the serous fluid would be present. Serous fluid would be present. So now I think we are very properly oriented. True? Okay. So when this is midgut and hindgut, this is very easy to identify, right? And that's our foregut. So this is foregut. Things are pretty similar, right? Except this is gut, this one and this one. So this is dorsal and this one would be the ventral. So for mesogastrium, I'm just writing meso G, right? Giving respect, meso G. Okay, so this will be dorsal mesogastrium and this one would be the ventral mesogastrium. Yes, this is posterior, right? And this one is anterior. Okay. Now starts the journey. Now from this point onwards, at any point, if you feel like no, things are not clear, immediately stop me. I'll repeat that point. Because from here, all the way for next 20, 30 images, it is a continuous process. It is like you have to really imagine that, okay, how exactly the things are happening. Remember, we are now dealing with the foregut only. In other words, we are dealing with stomach. We are dealing with stomach plus D1, that is first part of duodenum, right? So as at the end of this entire development, we would be crystal clear that okay, stomach, so that is covered by which peritoneum, what is front, what is behind, what will be going from lesser curvature, what will be going from greater curvature, what exactly is happening to those curves, everything would be crystal clear, right? That's how we'll be completing the entire journey up to the pelvis. Okay, so now it is rotating, right? So foregut rotates, right? It is foregut starts rotating. So it rotates, but it is not rotating alone. The way Earth is moving, but Earth is moving along with the atmosphere, right? Otherwise, say if atmosphere is not moving, you jump and the Earth would shift, right? And you will be reaching to other place. So here Earth is moving along with the atmosphere. So same way here foregut is rotating and so does the mesogastriums, right? So plus with mesogees, right? Mesogastriums, right? So that is dorsal and ventral. Okay, so it is rotating. Let's rotate it further. Now it is rotating more, right? So this is just like a process, right? So this is the rotation, it continues. Okay, now you have understood that that's how it is rotating. We are now changing the plane, right? We are changing the angle. This, what we saw was the cut section. Now once again we are watching from the front, right? So how you will coordinate? You'll coordinate it like that. This was the image, this was the image, here was the gut, and here was, right? And with the rotation, say this is the ventral mesogastrium and this is the dorsal one. So let's focus only on the ventral mesogastrium. That means we are watching from the front. This is anterior. So when we watch from the front, we are watching from here. So this is a cut section, right? Now we are watching the whole tube. This whole tube is moving. So it means that ventral mesogastrium, which was like this, now it is folding, right? Now it is moving. So over here, right, over here, as we are watching, so this is, we'll write anterior view. So as we are watching from the interior, this is on this entire line, on this line, right? It is which point? It is this point we are talking about, this point, right? It is this point, which is this line, right? So all those dots, they make one line, and this line, it is ventral mesogastrium, right? It is ventral mesogastrium. All right, it will be still more clear as we move. See, now this is exactly the same thing what we saw just before few images, that when the tube rotates, right, and on one of the side it starts expanding. So now we have added one component. So focus on this ventral mesogastrium. In other words, we are just developing the stomach, right? So here it is, expands, done. So stomach is ready. But now we understood one important thing. And what's that? And that is that this stomach is ready. But what we were talking about, that ventral mesogastrium is actually attached at the lesser curvature. So this is the lesser curvature, right? Very fine, right? Lesser curvature of stomach, right? So that's how, say, it is happening. And obviously D1, first part of duodenum. So important finding is this, that it is the ventral mesogastrium, it becomes lesser curvature of stomach. That's where it is attached, right? That's where it is attached. So this part is, I think this part should be completely clear, right? So I'm putting a star because this is very important point, that ventral mesogastrium, it arises from lesser curvature of stomach, right? Okay, moving further. Looks like the same tube, right? But this time we are watching it from the back, right? So this is like a posterior view. Now say if you are watching it from the back, right? So then this would be, this entire line would be, yes, it would be dorsal mesogastrium, correct? dorsal mesogastrium, and it starts same way. And see, these two processes, both of them, they are occurring simultaneously, right? You understand that ventral and dorsal, they are playing their roles together. We are just trying to watch step by step, right? That's why it is like this. So here it is, it expands. Yes, it would look like, because we are watching from the back, right? That's why the direction has changed. Otherwise, this is like as if it is happening with us. So how it will go in our body. And here is the stomach and the fully developed stomach. The stomach has developed. Now this stomach, right, on the greater side, on the greater curvature, this is the greater curvature. So without further explanation, immediately you will know that greater curvature of stomach, right? So that is thanks to thanks to thanks to dorsal mesogastrium, correct? Main reason dorsal mesogastrium, because we are watching, this is the posterior view. This is the posterior view. We are watching from the back. Done. And yes, we'll never forget this D1, right? So it is the stomach plus D1. They are from foregut. Fine. And the best part is that there would be a separate artery for foregut, there will be a separate blood supply for midgut, there will be separate blood supply for hindgut. So actually it becomes much easier to remember that who is supplying what. Right? Okay. If you have joined bit late, right, so we have completed one important concept, but I'll go through that very fast, but it is necessary, because otherwise, from this point onwards, things will become bit tricky. Because from 2D, I'll be shifting the gears to 3D, right? What is gut, right? GIT, it is like genito, say, this is the entire, in simple words, digestive system, right? At this point of time, just remember gut is digestive system, right? So entire digestive system, it starts with that tube, and its location, abdomen, right? Okay, and it's fine, means you can ask any question, right? Don't worry. Okay, so here it is. This is what we were talking about, that in case of foregut, there is dorsal mesogastrium and the ventral mesogastrium, right? Dorsal mesogastrium and ventral. Dorsal is posterior, and this is the digestive system. We are into the process of development of digestive system. And as we go down, right, here is this, the gut, the tube which will be in future, it will be forming the digestive system. It rotates. So this gut rotates, right? It rotates along with the mesogastrium. So dorsal and ventral, both mesogastriums, they rotate, and that's how they continue rotating. Okay, this is the anterior view, and now we are watching that tube. It is this tube, right? We were watching only this portion, so it is this tube. Now it is rotating. So over here, this is like a complete fold which is on the anterior side, and that's why this is ventral mesogastrium. It rotates, and on one side it expands, right? One side it keeps on expanding. So in other words, over here the rate of growth is much higher as compared to the opposite side, and that's the reason it is going all the way towards formation of the stomach, and here the stomach is ready. So on the lesser side, lesser curvature of the stomach, that's developed by ventral mesogastrium. This is one important point, so that's why the star was marked, right? Mesentery and mesogastrium means same. Yeah, at this point of time, just consider it as same, right? As such, mesentery is slightly different, but don't worry, right? When it will come, I'll let you know. Right now, you just consider mesogastrium, right? The word mesentery, though, we have not yet used also, but it will come very soon. Fine. Okay. Yeah. So now this is the posterior view. Dorsal mesogastrium is what we are watching. Once again, one of the side, right? It is developing same way, right? Because these two processes, front and back, they will be happening together, and the stomach is ready. And here is what we get, that dorsal mesogastrium has given rise to this greater curvature of stomach and the peritoneum fold, which will be attached to that, right? So again, this is important point. We put a star. Okay. Now, say in development, it is not only these things are, only the stomach is developing, right? Along with the stomach, say this is all mesoderm, right? Then few cells sneak in, and in between there starts the development of liver. Now, how fantastic, right? Liver starts developing into the ventral mesogastrium. As such, if you see, it is so simple, right? But when we tell someone, it looks so impressive, that's yes, liver cells would start developing into the rotating ventral mesogastrium, and people would faint, right? As such, we know, yeah, it is so easy, right? And and the counterpart of liver is spleen, right? So that's spleen. So this is spleen. No further explanation needed, right? That spleen would be developing into the rotating dorsal, right? Dorsal mesogastrium. So far, so good. Now, changing the color and writing one very important concept to remember it, that whenever duplicate layers they come near each other, they fuse. Now, this would be the point where the confusion should start. In case if it is there, we'll go back to that figure and we'll understand it. Right? Today, I have turned all the clocks off. Right? There is not a single clock in front of me, and I'll not be looking at it because this is that vital topic. Arre, anytime. Okay. So what I was telling? Yeah, duplicate layers, right? So duplicate layers fuse together, and from this point onwards it would be like a game, right? It would be like a game. That's where suddenly we'll find that why those ligaments are appearing, right? The ligament which is from stomach to spleen. Array, this is making sense, right? Here is the stomach, here is the stomach, here is the spleen, right? So, and you remember yesterday we said that these ligaments are what? These ligaments are nothing but peritoneal folds which are between two organs. All right. So now this is the peritoneal fold, correct? That's the peritoneal fold which is between whom? Which is between stomach and spleen. So in case if we really want to give some name to it, we can definitely say gastrosplenic, and then because it is peritoneal fold between two organs, so we just name it ligament. Now this is too early to give it a name because, right, there would be some changes occurring into it, right? Few of the layers would fuse, etc. Right? But just I will write over here for understanding, right? For understanding. At this point of time, don't tell anyone that this is gastrosplenic ligament. This is just for understanding, right? You'll see that how beautifully these ligaments they will develop. Okay, right now everything is in process. Okay, let's move further. Now see what happens. There is change, there is difference in the speed at which the liver enlarges and the spleen enlarges, and the rotation occurs, occurrence of rotation. So here two things are happening. Liver, right? Liver develops rapidly, right? Liver develops rapidly. Now, when the liver is developing rapidly, what really happens as it expands, it pushes the stomach on the opposite side. Make sense, right? So here it is, this is liver, which is developing rapidly. So all we need to understand that it will actually push the entire content, right? All the contents on the opposite side. Things do not end at this point. Liver is enlarging rapidly and it is becoming bigger. Now, when it becomes bigger, till this point, everything was fine, right? Because see, everywhere it is this peritoneal fold is there, right? So, if I say that where would be the serous fluid? Here, here, in between, right? Sorry, I didn't draw it very nicely. Now this is okay. This is okay, right? So that is the place where there would be serous fluid. What I really am trying to explain is that if I say this would be the parietal layer and this one would be the visceral layer. Fair enough, right? And liver has become bigger. When this thing happens, and you'll appreciate this when we'll be studying ligaments of liver. So many ligaments, right? There would be few ligaments which will be connecting it with the, say, front. Some will be connecting it with the stomach. Some will be connecting even with some vessels. They will be coming into that picture. So it is simply because it has expanded rapidly and then something happens. This is the ultimate thing. The liver presses against the body wall, right? Liver is expanding very rapidly, so it presses against the body wall. So liver presses against body wall. I'm putting a big star as what would happen is, see, can you see the dash over here, dash? This is the indication that these layers, right? Say that there was a serous fluid, liver expands, and it pushes these layers so that they are obliterated. Obliterated means they are obliterated word means, say something, say this is like this, right? A tube, and you just press it over here so that things they stop from here, right? This side is one, this side is opposite, like it is pressed. So the moment it is pressed, both of them they will become separate. Interesting. So now you have got cavity 1 and you have got cavity 2. They both are separate, right? They both are separate. All these things, they will be forming all those lesser sac, greater sac, everything, right? Serous fluid is secreted by I told you, serous fluid is secreted by the visceral layer of peritoneum, right? Yesterday we talked about it. Okay, no worries. But you understood this concept, because from this concept so many things are say based on it, right? So here these layers are obliterated. Good one, right? And that leads to separation of those two cavities. So all you need to see is this. See over here, this is a continuous cavity, right? This is a continuous one all the way. It is going here, everywhere, right? This is one. But when it would be pushed, so this would be blocked. When this is blocked, it would be, this is one cavity, that is second. What are the names? We'll see that. But got the idea? That's how it is happening. So here it is this. Okay. Yeah, exactly. This is good. Internally, you keep on answering. That is very nice. Thanks, Ankit. Okay. So result, what is happening? That let's first focus on this two, because this second cavity is, it is at times, if we try to see straight away in the book, that okay, this is a pocket which is behind the stomach and it is called as lesser sac. It never enters into the mind that where exactly is this lesser sac. And when you dissect, say it is a space, right? You remove the liver, you remove the stomach, and boom, means you find that where is it, right? This is what you need to understand, that this pocket was created. This is a pocket. This is a pocket. This is a space, right? Pocket behind, right? Behind stomach, right? Why are we telling that it is behind stomach? Obviously, this is posterior, right? This is posterior and this is anterior. And who is playing this entire game? Well, this thing occurred in ventral mesogastrium. है right? It was anterior because liver developed into ventral mesogastrium. Fine, right? Very clear. And this pocket which is behind, this would be our stomach, correct? That would be the stomach. And because liver is expanding, it has pushed the stomach and then it pinched the wall, right? So that this entire area, that lake, is separated, and that space which is just behind the stomach, this pocket is behind the stomach, and this is what is called as the lesser sac. The lesser sac. Sac means bag. Lesser sac. Is the formation of lesser sac completely clear? Right? I don't mind explaining it again, but it is so important. Right? Because from here, then we'll go for this epiploic foramen, this, that, but it becomes much easier, much easier. Because the next step is, again, you have to imagine a bit, right? Okay. In case of any doubt, just let me know. But let's proceed. Now we are focusing, we have just zoomed that image to see that that's the liver, correct? And this one is ventral mesogastrium, correct? Ventral mesogastrium. And something, it is a peritoneal fold, right? It is a peritoneal fold, and this peritoneal fold is between liver and stomach. So we'll give this a name. We'll give this a name, and this will tell it as lesser omentum. Lesser omentum, right? Lesser omentum. Now, in case if you are even slightly disoriented, right? Remember that this is the area. This is the area which will be, if you watch it in vertical section, this is where the lesser curvature of stomach was getting formed. True? Because dorsal mesogastrium was developing greater curvature. Am I clear? Right? Okay. So here it is. This is the posterior part, right? Just for the reference. And this we are marking as stomach, because why stomach? Stomach plus D1. In fact, D1 too is bit lower. So let me not write D1. This is stomach because we are dealing with foregut, right? And in foregut only there is ventral and dorsal mesogastrium. Otherwise, so imagine as we'll proceed, things will become so easy because there will be only one mesogastrium and only we have to tackle with that. It is only in the upper part where all these formations they are happening. Now let's move our focus to this spleen. Let's see how spleen is doing, right? Now spleen is very smart. It is not developing or growing at the speed at which the liver is growing, right? So here it is this portion, right? That one. So this is dorsal mesogy, right? Dorsal mesogastrium, and we have already talked about this dorsal mesogastrium will be forming the greater curvature of the stomach, right? So when it is like greater curvature of stomach, So there is something which is connected, a peritoneal fold which is connected over there. So if we are calling this as lesser omentum, so let's call it a greater omentum because it will be having a greater surface. So greater omentum, greater omentum. Till this point, I think everything is fine, right? Any doubt, just let me know. Okay, so we have formed lesser omentum, greater omentum, and this one we write it over here. This is lesser sac, right? Lesser sac, thanks to liver, because he is expanding, and he expanded and he obliterated those layers, right? Okay. Now see, it's not so I'm trying to confuse, but it is like as if you are into the abdomen and you are watching up, right? That let's see what is happening above. So this is watching from below. So what I mean to say is, let's say if this is the body, right? So we are trying to watch from this angle, right? Sitting inside the abdomen and then watching that what is happening. So we'll find that this is the liver, right? Where is anterior and where is posterior? Well, this is anterior, correct? This is anterior, right? And this one is posterior. This will give you still better orientation, right? So liver done, stomach done, and when we will see CT scan images, right? So at that point it would be still easier, right? You will be able to identify the things very easy. So, and this one is spleen, fair enough. And between stomach and spleen, what you have got? It is greater omentum, right? So greater omentum. And this one, that would be lesser omentum. Lesser omentum. And that's the lesser sac. And this lesser sac, classically, it is behind the stomach. That's the only thing which we have to identify. Things are good. Let's proceed. Oh, okay. How can we differentiate greater omentum and gastrosplenic? Don't worry about it. It will come. Right now, as I said that right now, all these, none of the ligaments, right now we have even, it was only for understanding. Right now things are into developmental process. When we'll see those real dissection, it will be very easy, right? Okay. Let's shift our gears from 2D to 3D now. This is where you have to really imagine 2D to 3D. Focus only on these structures: stomach, liver, spleen, lesser omentum, greater omentum, and the lesser sac. Anterior, posterior, that would be for the orientation. Fair enough, right? So don't worry about the ligaments. You will be actually able to see the ligaments, right? You will be able to actually differentiate that, yes, this is what, because the question, Gauri, that greater omentum, once you will see the greater omentum, you will laugh on yourself. Kare bapre, it is so big, right? And bichara, that gastrosplenic is so innocent, that small rabbit like sitting deep in the corner, right? And this this greater omentum is like a monster, right? A huge one. Right? Okay, so coming back to this is now 3D, right? In this, this is our head end. Okay, and that curve, yes, this curve, that is as always, this is our back. Okay, so what's this? The moment we see that there are two mesogastrium, that means we are dealing with foregut. We are dealing with foregut. Right? As it develops, so this is anterior and posterior. So posterior part, that would be dorsal mesogastrium, and this one would be the ventral mesogastrium. This part is easy. Okay, adding something more. So it is now rotating, right? It is rotating and into the ventral mesogastrium, right? Anterior portion, that is ventral mesogastrium. There is formation of this new tissue, right? So that is none other but it is liver, correct? That is liver which is developing. So here is the entry of liver. Meantime, this one is dorsal, right? It is dorsal mesogastrium. That was okay. Going further. See, the process continues, right? It is rotating. But here we would see one important thing, and that is this is liver, right? This is the stomach, and here is the free margin. है ना? This is stomach, and then there is a layer which is going like this, and in that layer liver develops. So then the margin which is between stomach and the liver, there is no one else, so this becomes a free margin, right? It becomes a free margin. Its importance is enormous, right? So just remember two structures, and if a layer is hanging in between, obviously it will be having a free margin. Okay, we will come back to that figure again, right? But meantime, first we see one more important thing. Here it is, that is spleen, right? Gastrosplenic ligament in greater omentum. अरे बाप रे, same. I am telling the same thing. Why are we worrying about gastrosplenic ligament at this point, right? Don't worry about gastrosplenic ligament at this point. First, just understand, focus only on what is getting shown, right? Because gastrosplenic ligament and the greater omentum, the size of the greater omentum is so big, I'm repeating it. I just said this thing before only 2-3 minutes back. Greater omentum is so big, gastrosplenic is just a smaller one, and it will come. Yeah, here is the spleen, right? Here is the long awaited spleen. That's the spleen. You're right. So that's the spleen, and we know that spleen develops in dorsal mesogastrium, right? Dorsal mesogastrium. So friends, when I said that gastrosplenic, that was, I wrote it very specifically. It is only for understanding. Right now, don't even write that it is a gastrosplenic, because there is still the folding which is going on, right? Then it develops, because when those layers, they fuse with each other. That's the point, that when the layers, double layers, they fuse with each other, and then there is only a sharp ridge which is left out, that becomes a ligament. So right now it was just for the explanation that between two organs. Okay, yes, it will come, definitely. Because if there is nothing like, say if there is lesser sac, there has to be a greater sac, otherwise they would have named it as sac, right? Just sac. Okay, so this is dorsal mesogastrium and this is spleen, right? Wait, it will come, yeah. Now see, right, this is expanding, right? Things are expanding, and over here this is the free space, and liver has obliterated, right? When the liver obliterates, so this, see, now you have to watch this. Actually this is what it is. Lesser sac, that's the space which is behind the stomach, right? Which is behind the stomach, and that one would be the lesser sac, because liver has obliterated, it has separated those things, right? Separated that, those two which we saw before. And this lesser sac, that is behind stomach, this is behind the stomach. Okay, developing better and better, right? So how the things are going right now, the margin which we are watching over here, this one, right, it has to be which omentum? It has to be lesser omentum, right? Lesser omentum is, because this is in association with the liver, so no doubt about it, true. Then on the opposite side, that's the spleen. So over here, this one would be because of dorsal mesogastrium, right? Dorsal mesogastrium, and this would be the greater omentum, right? Greater omentum. Now from this point onwards, right, till this point, to greater omentum, lesser omentum, they are almost of the same size. But then this greater omentum, right? This greater omentum, it starts developing down, right? Huge, so much so it covers the entire abdomen, right? So when you just put a cut, when you open the anterior abdominal wall, the first thing what you will watch is greater omentum, right? That's why it is called as policeman of the abdomen, because it first covers, is the first thing which you will encounter when you do the dissection. Okay, yes, see, now things are giving proper shape. That's the stomach. This is the first part of duodenum, right? Because from here onwards, all these D2, D3, right? This would be the second part. That's where that ampulla of Vater, that is the, right? Those ducts would open, and this is where there would be D3, and then there would be D4, right? And that's the spleen. That's the spleen, and this one is liver, and this is the free margin. This is the free margin. Don't forget this free margin, because you will be able to actually see this free margin, right? Okay, everything is growing, right? It is constantly it is growing and rotating, right? And rotating. So over here we have adding D1 fully, right? Adding D1. So that's a full D1 which we are watching. So it means total D4, four duodenum, 4 parts of duodenum. And this is stomach, right? And as soon as we have added this D1, right, duodenum 1, so this opening, right, this is a very important opening, because it is a free margin. Liver is enlarging, and that free margin, it remains a free margin only, right? It remains a free margin. So it happens like, that is what is called as the epiploic foramen. Epiploic foramen. Because think it like one organ, second organ, and then there was free margin. But then this kept on enlarging, and then there is the duodenum. So this free margin, now on one surface there is liver, but this margin, it remains free. So see the space, has been created, and that is what is called as the epiploic foramen. And this is formed by what? Formed by whom? The lower border, right? Definitely the lower border, right? Lower free border, right? Lower free border of lesser omentum, right? Lesser omentum. Perfectly clear? So that's over here. D1 is in close association with liver, right? So D1 is with liver, correct? So that's where the foregut ends, and the lesser omentum also ends, because lesser omentum is because of the ventral mesogastrium. Ventral mesogastrium is anterior. Now mid and hind, they don't have ventral, they have just got the dorsal. So that's it. So this lesser omentum will end at this point. Lesser omentum won't be moving further. So foregut, correct, ends here, ends at D1, and therefore the lesser omentum, right? Makes sense. Okay. Now see, this is just a small zoomed version, but just wanted to show that this opening, right? This is epiploic foramen. So in Viva now, if any of the question is asked that why, how this epiploic foramen occurs, because of which mesogastrium, because of which omentum, this, that, right? That's all those things, they are now absolutely easy, right? Okay. Here you have to imagine a bit. And that is that this epiploic foramen, right? This epiploic foramen will be taking you where? It will be taking you into the lesser sac, correct? Because see, this was stomach, this is liver, there was like peritoneal folds between them, right? Then liver pinched this side, so this lesser sac is separated, right? And then there is peritoneal reflection which will be on the anterior side. So that let lesser sac develop, but its free margin, it was there, right? It was that free margin. This free margin was already there, right? It remained as it is, it which turned into epiploic foramen. Epiploic foramen. So this epiploic foramen, right, will actually take you all the way into the lesser sac. Lesser sac, that is behind the stomach. Okay. Now we are adding one more step. The way there is free margin in case of ventral mesogastrium, that's not the case with dorsal mesogastrium, right? Yes, foramen would be connecting. Yes. Right? So there won't be, say, such free margin in case of dorsal mesogastrium, because this is dorsal mesogastrium, right? Dorsal mesogastrium. This dorsal mesogastrium, it folds upon itself, right? It folds upon itself. So the way, right, say this is like a chadar, right? And sometimes when we feel so much cold, so we just fold this chadar into double, right? Same thing. This folds upon itself. It means if you watch from the side, this is how it will look like. It will fold upon itself. So over here, this is how it will fold upon itself, right? It will fold upon itself, and then it will continue to grow. We'll see. So the word over here is folds upon itself. See how it folds. This, right? So when it folds upon itself, a sac is created. Now the sac is created, right? A sac is created. Because if there is free margin, so then a sac cannot be created, right? But it folds upon itself, and that's the greater omentum. This is where the greater omentum will develop. Greater omentum, right? Which will keep on growing below. So over here we have got the ventral mesogastrium. That is what this one is, epiploic foramen. Right? And that is the lesser omentum. And then it forms this lesser sac behind the stomach. To this, we now add transverse colon. Why are we adding transverse colon? That's because when we'll see it in another section, we'll remember that part, that these folds, right? If two similar folds come near each other, they merge with each other, right? Now that process is going to start. So adding transverse colon. So this is a continuous process, right? This is a continuous process which we are watching in every stage. Now, dorsal mesogastrium is here, right? That's the dorsal mesogastrium. Now this is in front of transverse colon. So that transverse colon would be posterior, right? This will be developing in front. So dorsal mesogastrium in front of transverse colon. So think it like this, that this dorsal mesogastrium is going to become greater omentum, and transverse colon is on the back side, is posterior, right? So it means that when you will lift dorsal mesogastrium, because there would be a reflection upon itself, so you'll be able to take that entire thing as a curtain, right? And you will find that, okay, that transverse mesocolon is lying just behind it, correct? So this is very important point to remember. And don't worry, even if there is slightest of doubt, we shall be watching all these even practically today itself. Okay, what if we cut this image and we rotate it, right? It is like a sagittal section, right? So let's take a sagittal section. I think at this point things are pretty clear. That's the lesser sac, right? That's the lesser sac. This one would be the greater sac. This will be like greater omentum as it will be developing further down, right? That is epiploic foramen, right? And this is the lesser omentum. Lesser omentum is between stomach and the liver, right? Because that's the only organ which is over there. Dorsal mesogastrium and free space lies on each other. Yeah, obviously. That's how the sac has been created. That's right. Now it will be much better, right? Much clearer, because now we are taking a section. So here is the liver. right? And over here, that's the stomach, correct? Simply, this would be the lesser omentum, right? Lesser omentum. No doubt about it. This one is anterior and this is the posterior side. Okay. Now it happens like, say, this is transverse colon, right? So this part, it is called as the transverse mesocolon, mesentery, which is covering the colon. So that is transverse mesocolon, right? That is transverse colon. This structure, which is over here, it is pancreas. It is posteriorly, right? Why it is so? Right now, just trust that pancreas is there, right? We don't want to deviate it. We just want to see one thing, that this one is the greater omentum, right? It is the greater omentum. And it is this greater omentum which will keep on developing down, and that's how it will be covering the entire curtain, right? It will be acting like a whole curtain. And this pancreas, because it is over here, it is behind the peritoneum, that's why we'll be calling it as a retroperitoneal structure, right? It would be a retroperitoneal structure. Let's see further and it will be still better. Here it is, right? Say greater omentum, it keeps on growing downwards, right? So greater omentum is going downwards. Say it has folded upon itself. So that's why it has got layer 1, layer 2, layer 3, layer 4, right? This is 1, this is 2, this is 3, this is 4. But meantime, some interesting thing is about to happen. And that is, as the peritoneum is going down, it is this transverse colon, right? This transverse colon is trying to catch this greater omentum. So here is the transverse colon, and transverse colon has got what? Has got its own covering, right? That is the peritoneal covering. So that principle now starts working. Let's see, as it is going near, right? So here is the peritoneal layer, right? And this is means parietal layer. This is also parietal layer, right? This is also a parietal layer. So all these layers, they are similar layers. So they are called as the duplicate layers, and this is continuously going down and down, right? So it happens like this, right? Say it is going down, right? And now this is what is happening. See? Got the idea? This layer, these layers, they start fusing because they are duplicate layers, right? They are duplicate layers. And this is the greater omentum. This is greater omentum, right? And that one was transverse mesocolon, right? This one is transverse mesocolon. So they both, this is also greater omentum, correct? Say all the way which has folded upon itself. So that's a greater omentum. So this greater omentum and transverse mesocolon, they both are coming near to each other, right? And when they come near each other, this is how they fuse, right? So that dash line, right? That is where the duplicate layers. So these duplicate layers, they are absorbed. So duplicate layers are absorbed. So it means what has happened? Now this greater omentum is actually attached with the colon, transverse colon. So when we lift the greater omentum, we won't be able to see the transverse colon as if it is lying isolated. No. On the anterior surface of the transverse colon, this greater omentum would be attached. Obviously, over here. Here it is. This is anterior. Right? Because those layers, they got fused. Till this point, kidney is retroperitoneal. Till this point, the thick, right? This is like greater omentum is completely separate. But then these layers, they merge. And when they merge, that's it. This is attached now over here. Now the reflection will go like this, right? So that's what has really happened over here. The reflection is now going like this, right? Those layers, they merged. At the same time, you must have noticed one more thing. Previously, the greater omentum was like this. We were having 1, 2, 3, 4 layers, right? 1, 2, 3, 4 layers. But then as it was expanding, these two layers, that is layer number 2 and layer number 3, they are also duplicate layers. So they also merged, right? So that's how this is really happening. So then there is fat in it. Got the idea, right? And here it is. This is the final output, right? See how good the whole thing is, right? So this is stomach, right? That's transverse colon, and now the greater omentum, right? And so that's transverse colon, and this one would be between the colon and the pancreas, right? So this is the greater omentum which is stuck to transverse colon, right? So that's the greater omentum, right? This would be the greater omentum, correct? Because the rest of the duplicate layers, they have fused. Yeah. So what's this? Behind the stomach, right? Behind the stomach, this is lesser sac. This is lesser sac, which is behind the stomach. As things have developed, right? This is stomach. This is colon. So now there is a very perfect fold which is lying over here. So now we can call it a ligament, right? And this is between stomach, so gastro, and the colon, so colic, and the ligament, because it is a peritoneal fold, so gastrocolic ligament, right? Let's see the real things. This image is same what we saw yesterday, right? That's the parietal peritoneum. Which is for protection, which is like fibrous, right? You know that. That's where we see the serous fluid, which is between two layers. So everything is shiny, serous fluid. Okay. That's what I was talking about, right? Say in small intestine also, right? The peritoneum, as we say that it is like a double sheet, right? There are the double sheet, and in these double sheet, in between these double sheets, right, there is one layer, second layer. There would be blood vessels. There would be blood vessels through it. That's how they look like, right? That's how we see that, okay, all these blood vessels, they are present in between these two layers. Okay. Let's orient properly. Nothing has been done. All we have done in this case is just the anti-abdominal wall has been removed. Bus. So this is see, this is stomach. So when the stomach is like this, right, and it would be like this, and then, right, it would happen like this. So this is the greater curvature, and that's where this entire thing, right, all this entire thing, right, is nothing but greater momentum. It is greater momentum, right? Let's remove it. Fine, right? Greater momentum. Now we are lifting this greater momentum, right? Because we know that it is the lower, this greater momentum is like this. So we can just catch hold of this and we are just lifting. As we lift, right? Right? As we remove this, we are watching that yes, there are, see this, these are all small intestine loops, right? So these are like jejunal loops. Jejunal loops. We have not yet discussed it, but we know one thing, and that is beyond foregut, there is only dorsal mesogastrium, right? So only on one side it is attached. So that's how we really see it. So this is the mesentery. This is the mesentery. Stomach looks so small because we have not yet explored it, right? You'll see it's a huge stomach. Okay. So mesentery of these jejunal loops. Okay. Coming back to now this part. What it is, right? Say this is orient yourself. This is, see, I'll draw it, right? Some small portion is going behind and then going like this, and then here, splenic fracture. This is ascending colon. This is transverse colon. And this is descending colon. Ascending, transverse, descending colon, right? All right. So this is stomach, correct? Now, that's fine, right? This is all colon, right? That's the colon. And between stomach, this is the stomach. That's the colon. What you are watching is, right? I'll just highlight it. What you are watching this. This is gastrocolic ligament. Gastrocolic ligament. So these ligaments, right? These ligaments, they are nothing but peritoneal folds. But because they are between two organs, so when these two organs are, they were having separate peritoneal folds, but the duplicates, they merged with each other, right? So that's why it becomes thick. So this is gastrocolic, between the stomach and the colon ligament, and it is this ligament, it is nothing but it is thickened peritoneal fold between two organs, right? Which organ? As the name suggests. So that's the stomach, this is colon, and this is what is between both of them. Okay. Now, still we are trying to watch, right? This is liver. This is liver, right? And say that's the stomach. Interesting. And see, Rest of the structures, they have been cut so that you can actually watch this gastrocolic ligament very clearly. This is gastrocolic ligament, bit stretched so that you can watch it properly, right? So that is gastric and colon, in between both of them, gastrocolic ligament. See, now the stomach would look a bit bigger, right? As more and more area is getting explored. So here is the stomach, right? Right. This one would be the diaphragm. This one would be the diaphragm, right? And in this diaphragm, this is the opening. And through that, the esophagus would go up. So that's the esophagus, right? And this one is stomach, correct? Looking at the stomach separately, right? So in case of stomach, this upper end we can also call as the gastroesophageal junction. So from this point onwards, we'll call it GE, gastroesophageal junction. Right? This one is called as the fundus of stomach. Fundus, right? That's the shape of the real stomach. It is like a bag. Another angle, right? So this one would be gastroesophageal, and this end, the other end, it is called as the pylorus. Pylorus, right? This area, that's called as the pyloric antrum. Now when we'll cut the stomach, we'll find that yes, this is really important, right? So see here, this one is pylorus, right? And this would be the pyloric antrum. Now this GE, gastroesophageal, this one is the GE, gastroesophageal junction. Now this GE is not very powerful, right? But this pyloric end is extremely powerful. Right? Same thing. Right? Now see, there are reflection also. This is the peritoneal reflection, right? But we'll come to this. So meantime, this is pylorus, right? The pyloric antrum, you know. Fine, all good, right? So that one is like lesser curvature and this is like greater curvature. So all those coverings which you are watching, they are like partially removed, but all these layers, these one, they all are peritoneal reflections, right? Okay, fair enough. And here is, now we cut it. Now see, as you cut inside of stomach, watch for pyloric antrum. See the marked difference. That was the pyloric antrum, right? I said that it is pretty different. Now for the stomach, we have talked about it. This is inside, right? Inside of stomach. For stomach, we have talked about that there are two things. One is the muscular layer and the second is the mucosal layer. Correct? See, that mucosa is not present everywhere, right? So at some places, so it is very thin. Right? So here is the outer layer. So outer layer is smooth muscles, right? Or the muscular. So smooth muscles. The inner layer, right? That is mucosa or the mucosal layer. So that is inner. Right. What's the function of these? Why they are mucosal layers? They are like this. They are thrown into folds. Right. They are into folds. Because when they are into folds, they increase surface area. Though stomach has got capacity to expand, but this is where it increases surface area. That's the fundus. And you must be watching that fundus. Mucosal layer is smooth. Right? Mucosal layer is pretty smooth. It is not thrown into folds that much. It is only the pyloric antrum part which is thrown into so many folds. Yeah. That's what we said. There are junctions, there are sphincters. So one which is above, it is called as the cardiac sphincter. Sphincter, so it is like this, right? It closes, right? So this is like cardiac sphincter. Cardiac sphincter. So these are the muscles. Can you see these muscles? These muscles, they are like surrounding the entire opening, right? So these are the muscles. So they form that thick muscular ring. Muscular ring. And this is what really prevents that reflux, that acid is not coming back, right? So whenever there is belching, right? Belching is when we try to throw out, right? So at that point, this opens. Now this, as compared to pyloric sphincter, this is not very powerful. This is less powerful than pyloric sphincter. Okay. This is how it looks like. So if you watch pyloric sphincter, just the comparison, right? Pyloric sphincter, how strong the muscles are, and so many, right? It is almost obliterating the whole thing. So this is highly effective, very strong, very powerful, highly effective. That's like at an angle, right? This is the selfie shot sort of thing. Mucosal folds, right, of pylorus, they are protruding because say this would be very interesting angle. This is right D1, that is duodenum, right? How nice if we cut it from here and then we watch from this angle, and this is the pyloric antrum, right? This is pyloric antrum, and those folds, they are over here, and we are watching it as if we are sitting inside the duodenum D1, and then we are watching that yes, those pyloric mucosal folds, they are coming up, right? So these are the mucosal folds, right? And we say as seen from D1, right? The first part of duodenum. Here it is. Okay. So when we say this is fundus, on the surface, right, we get this attachment, and that's the attachment which we were waiting since long, and that's the greater omentum. Correct? That's the greater omentum. So if that's the greater omentum, see, right? So over here on all these, this is lesser one, that is lesser omentum. All right. Coming back to those images, right? See, what we are watching is now the lesser omentum. The liver has been partially dissected. So this is the liver, right? That's the liver. And we know that between liver and the stomach, so here is the stomach. See, gorgeous stomach, huge one. right? All the way. This is stomach, 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 right? Don't call him Petu, right? But yeah, a big stomach. And see, interestingly, you can watch one thing. So that is liver, right? Over here, that's the stomach, right? And eventually here is the gallbladder, right? So somehow this gallbladder, which is storing bile, right? What has really happened is that this stomach, right, as it goes, see, because of the bile, there is a greenish effect. This is the greenish effect, right? Greenish discoloration has occurred. See, got it? Right. So that's how it is. But what we are interested in is this. This is the liver side, right? And that's the lesser sac, right? Now there is no problem, right? This is the lesser sac, or the lesser curvature of the stomach, right? Let's take it that way. Curvature, lesser curvature of stomach. And from that lesser curvature, there goes, right? So it is, there is a fatty part, there is so this is where the fat accumulation is there. So that's the fatty part, right? And it goes like this is the liver, that's the stomach, and this is what we are watching, right? This is liver, that's the stomach. In case of stomach, lesser curvature. And what it is nothing but lesser omentum, right? That's the what we are watching, lesser omentum. And lesser omentum is formed by ventral mesogastrium, correct? Yes. Now if we put a cut on it, right? If we put a nick on it, so we just open this lesser omentum. So when we open this lesser omentum, see, this is the free margin, right? That's the free margin. Can you see something like gufa, right? As if, yeah, you can enter into that, right? This is epiploic foramen. And I'll remove this because it is very nicely seen. So you should be getting the, yes, that impression. So I'm just drawing it just like small dots so that you know, bus, right? So this will give you the clear picture. And via this, right, when we put a nick, here it is. And when we peel it, when we open it, this way, this way, so we are entering into lesser sac, right? So that's nothing but lesser sac. We are entering into lesser sac. And it is this lesser sac, another name is nothing but omental bursa, right? Omental bursa. It is just another name. Yeah. That's the greater omentum, right? Simply speaking, absolutely untouched greater omentum covering entire abdomen, right? That's why it is like policeman. So here it is bit stretched out, right? And sorry, and it is stretched out, right? And we find that there is something over here, right? Something over here. Well, don't worry, this is like stomach, right? And from greater curvature, it is going down. So far good. And we lift it, right? And we lift it. So think it this way. Think it this way. That's the greater omentum, right? And this one would be the free border. All these peritoneum. Omentum is nothing but it is peritoneum, right? They all are peritoneum, peritoneal folds. And yesterday we talked about that what are the functions of peritoneum, right? So this is like a free border. And actually it is like a ghungat, right? So when it is lifted, because I couldn't think of anything else. So this is like a free border, and see how delicately the whole thing has been lifted, and that's the free border. Got the idea? Right? Say this free border which was like down, now it has been lifted. So this is the free border. This is the free border. And as we said that we won't be able to take this free border all the way up, because it is it is like it is like this. That's where the colon is. So when this is lifted, we'll be able to see this anterior surface of the colon. That's what we see, right? This is the transverse colon. This is the transverse colon, and see it is connected over there, right? So the back side of greater omentum is attached to the front of transverse colon. What's the big deal, right? Completely fine. This is the back side, this is the front side of colon. That's where they are attached. Here it is, right? Okay. So between stomach and and say colon, that is gastrocolic ligament, right? And we have to just appreciate it that this portion is bit thickened, right? It is thickened. So that's the location, in fact that's the location of gastrocolic gastrocolic ligament, right? Yeah. Now this is again, as we put, we lift it, and then we cut it. We put the neck in greater omentum, right? So this is a small cut which has put, right? So this is cut in greater omentum. Greater omentum covers only transverse colon, okay? Then why here everything is covered? Obviously, greater omentum is like a sheet. It covers everything. All the structures are behind it, but it is not attached to other intestines, etc. Right? That's why we were able to lift it till transverse colon. Got the idea? Because see the basic principle, foregut, midgut, hindgut. There is ventral mesogastrium is present only in foregut, right? And this is the dorsal mesogastrium. So when this is entirely it is rotating, right? So that's where the this greater omentum has been created. Now you'll find that greater omentum is in association with only transverse colon, right? But rest of them, yes, they have got the mesentery. That is what we'll be watching tomorrow, right? So over here, when we put the neck, yes, we enter into that sac. Correct. Okay. So at this point, all we need to know is you should be comfortable with following structures, right? One, that greater omentum, because this is like groundwork for tomorrow, right? Greater omentum clear, right? Lesser omentum, obviously mesogastriums, right? Dorsal and ventral. Epiploic foramen. Then lesser sac, greater sac, and one more important thing, that is gastrocolic ligament, right? This much should be clear. If this much is fine, right? So tomorrow we'll be starting from this point onwards, and we'll be going for all rest of the omental reflections. Once that is complete, right, we'll go for CT scan images, all the CT scan images. So right from it, we will be drawing like, say, this is like, right? So one cut here, then second, third, fourth, fifth, sixth, seventh, eighth, almost up to the pelvis will take it. Once it is complete, we'll take another angle, right? Another plane, and we'll see 3 or 4 images like this, vertical. So this will give us the complete picture that how things look like, right? So that's it for today, right? Thank you so much. I know these topics, they are bit complicated, and there is so much to understand in this, right? And as we'll see more and more images, it will be better and better, right? Greater sac. See, just a minute. Let me show you the greater sac. Because that was the image which was, yeah. See, as they are all getting absorbed, right? They are getting absorbed. Here is where you'll be getting the greater sac, right? So that's why when we put a nick over here, when we put a cut over here, we enter into the greater sac. When we put a cut over here, right? That's what we saw in this. See, that was lesser, and here it is, right? This is cut or nick in greater omentum, and that's where we see the greater sac. We enter into the greater sac. Now these things will be still more clear when we shall be talking about the liver, right? Because in liver, all these reflections, because they'll be forming so many other ligaments also, right? So that's what we'll be covering in tomorrow's session, right? So thank you so much, and we meet tomorrow at the same time. All right, bye bye and good night. And yeah, I'm saving it, and I'll put into our shared folder within a minute. Thank you.